Welcome to this comprehensive video on pelvic floor muscle relaxation exercises that can help increase your libido. Sexual health is an important part of overall wellness, and pelvic floor muscles play a significant role in sexual function. However, many people struggle with pelvic floor muscle tension, which can negatively impact sexual desire and enjoyment. In this video, we will delve deeper into the topic and discuss the anatomy of the pelvic floor muscles, common causes of tension, and how it affects libido, and a range of pelvic floor relaxation exercises that can help improve your sexual health. Section 1. Understanding pelvic floor muscles and sexual health. The pelvic floor muscles are a group of muscles that support the pelvic organs, including the bladder, uterus, and rectum. These muscles are also responsible for sexual function, including arousal, orgasm, and ejaculation. During sexual arousal, the pelvic floor muscles relax, allowing for increased blood flow to the genitals, and helping to maintain an erection in men and lubrication in women. However, when the pelvic floor muscles are too tense, it can lead to sexual dysfunction, such as difficulty achieving or maintaining an erection, or pain during intercourse. In contrast, when these muscles are relaxed, it can lead to increased blood flow to the genitals, improved sexual arousal, and a more pleasurable sexual experience. Section 2. Causes of pelvic floor muscle tension and its impact on libido. There are several factors that can cause pelvic floor muscle tension, including stress, anxiety, poor posture, constipation, pregnancy, childbirth, and menopause. Additionally, certain medical conditions, such as urinary tract infections, prostate problems, and endometriosis, can cause tension in the pelvic floor muscles. Pelvic floor muscle tension can have a significant impact on sexual health and libido. It can lead to decreased sexual desire, difficulty achieving or maintaining an erection, premature ejaculation, pain during intercourse, and difficulty achieving orgasm. Moreover, pelvic floor muscle tension can also cause discomfort and pain in everyday activities, such as sitting for prolonged periods. Section 3. Pelvic floor relaxation exercises. Deep breathing. Deep breathing is a simple and effective way to relax your pelvic floor muscles. Sit or lie down in a comfortable position and inhale deeply through your nose, filling your lungs with air. Hold your breath for a few seconds, and then slowly exhale through your mouth, releasing any tension in your body, including your pelvic floor muscles. Repeat this exercise for a few minutes, focusing on slow, deep breaths and full relaxation. Kegels. Kegel exercises are commonly recommended for pelvic floor strengthening, but they can also help with relaxation. To perform a Kegel exercise, contract your pelvic floor muscles as if you were stopping the flow of urine. Hold the contraction for a few seconds, and then release. Focus on fully relaxing your muscles during the release phase, allowing your pelvic floor to fully relax between contractions. Pelvic tilt. Pelvic tilts are another exercise that can help relax the pelvic floor muscles. Lie on your back with your knees bent and your feet flat on the ground. Gently tilt your pelvis forward and then backward, focusing on the movement of your lower back. As you tilt your pelvis forward, you will feel a stretch in your lower back and pelvic floor muscles. As you tilt backward, you will release the tension in these muscles. Happy baby pose. This yoga pose is a gentle and effective way to stretch and relax the pelvic floor muscles. Lie on your back with your knees bent and your feet flat on the ground. Bring your knees up to your chest and grab onto the soles of your feet with your hands. Gently pull your knees down towards your armpits, allowing your pelvic floor muscles to stretch and relax. Hold the pose for a few deep breaths, and then release. Child's pose. Child's pose is another yoga pose that can help release tension in the pelvic floor muscles. Begin on your hands and knees, with your wrists directly below your shoulders and your knees directly below your hips. Lower your hips back towards your heels and extend your arms forward, allowing your forehead to rest on the ground. Focus on deep breathing and relaxing your pelvic floor muscles. Hip flexor stretch. Tight hip flexors can contribute to tension in the pelvic floor muscles. To stretch your hip flexors, begin in a lunge position, with your right foot forward and your left foot back. Keep your back leg straight and press your hips forward, feeling a stretch in the front of your left hip. Hold the stretch for a few deep breaths and then switch sides. Full body stretch. A full body stretch can help release tension throughout your entire body, including the pelvic floor muscles. Stand up straight with your feet shoulder-width apart. Reach your arms up towards the ceiling, stretching your entire body. As you exhale, fold forward at the hips, reaching for your toes or the ground. Hold the stretch for a few deep breaths and then slowly roll back up to standing. In conclusion, pelvic floor muscle tension can have a significant impact on sexual health and overall wellness. By understanding the anatomy of the pelvic floor muscles, the common causes of tension, and how it affects libido, you can take steps to improve your sexual health. Pelvic floor relaxation exercises, including deep breathing, Kegels, pelvic tilts, yoga poses, and full body stretches, can help release tension in the pelvic floor muscles and improve sexual function. Incorporating these exercises into your daily routine can lead to increased sexual desire, improved sexual function, and a more pleasurable sexual experience.